Good afternoon, my name is Avi, I'm a nurse practitioner student. We'll be doing an assessment today, a head-to-toe assessment. Can you tell me what is your name?
Eli David,
Your date of birth?
January 1999.
Thank you, Eli. We're gonna do a quick mental status exam. Can you tell me where you are right now?
Doctor office,
Can you tell me what's today's date?
May 5th, 2025.
Okay. I'm gonna have you say 3 words. Repeat after me. Dog, table, apple.
Don't take a lot.
Okay. What is 100 minus 7?
93.
Okay. Patience, alert, and oriented times 4. What are those 3 words that I mentioned earlier?
Don't take a lot.
Very good. Okay, I'm gonna go on to the skin. Skin is intact, no redness on the skin. We're gonna palpate the skin. Okay, we're gonna inspect the head. No trauma on the head. No redness noted. We're gonna palpate. I already washed my hands prior, so we're gonna go ahead and palpate. Let me know if there's any tenderness. Okay.
No tenderness.
No tenderness, no masses were felt. Looking at the skin, there's no rashes, no rashes on the face as well, no redness, no edema, hair distribution is even, hair is not greasy. We're gonna go ahead into the eyes. We're gonna perform the Rosenbaum chart test. I'm gonna have you cover one eye. Read me the lowest line that you could read.
EPT,
Okay, cover other eye, read me the same line backwards.
OZT,
Using both eyes, read me this line.
CFD.
Okay, very good. Vision is 20/20 bilaterally, and cranial nerve 2 is intact. Okay, so now we're gonna perform the pen light. I'm gonna have you take off your glasses, please. I'm gonna inspect the eyes, inspect the eyelids. Eyes are symmetrical. No redness, no rashes, no swelling, no bulging. Iris is brown and well defined. Medial and lateral canthus can be seen, are pink and moist. We're gonna look at your conjunctiva. We're gonna pull down, have you look up. Pull up, have you look down. Okay, conjunctiva is pink and moist, sclera is white. We're going to do the pen light test to see if your pupils constrict. Pupils are 3 millimeters in size. Have you look at me. Okay, pupil constrict. We're gonna do tests for we're gonna shine the light on one eye and see if the other eye constricts as well. Look at me, please. Okay. Very good. Okay. Pupils are round, reactive to light. Constrict 2 millimeters. We're gonna test for accommodation. I'm gonna have you look directly ahead, focus on the wall. Now look at my pen light. Okay? Pupils dilated when you look at the pen. I'm gonna have you cover one eye. One eye. Let me know when you see my fingers wiggle.
See.
Okay, cover the other eye.
See.
Okay, very good. We're gonna test for extraocular movements. Have you look at my finger. Hold. 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 Okay. No nystagmus noted. Cranial nerves 3, 4, and 6 are intact. I'm gonna do the fundoscopy exam. Turn off the lights. Okay, with my right eye, I'm gonna look at your right eye. Okay, I can see your red light reflex. Retinal vessels are present. 0.3 disc margin. No opacities. Cup to disc is 0.3. Okay, macula is visualized. I'll do the same for the other eye. I'll turn the lights back on. Okay, we're gonna palpate the lacrimal sacs. Let me know if there's any tenderness, okay?
No.
No tenderness, okay? Going down to the nose. We're inspecting the nose. The nose is symmetrical. No redness, no swelling. I'm gonna test your smell. Have you close your eyes. Cover one nostril. Tell me what you smell.
5.
Cover the other nostril. Tell me what you smell.
7.
Okay, very good. Cranial nerves 1 is intact. Patient sense of smell is intact. Okay, I'm gonna palpate the maxillary and the frontal sinuses. Any tenderness?
No.
No tenderness reported. I'm gonna use a speculum to look inside of your nose. Okay. I'm gonna have you lift your head. Look inside. No nasal polyps. No deviated septum. Okay, very good. Okay, there was no nasal discharge as well. Going down to the mouth. Lips. I'm gonna start with the lips. The lips a little pink and moist. No deformations. I'm gonna have you open your mouth. Show me all your teeth. Smile. Okay, great. All your teeth are present. No rashes, no redness, no lesions. Open your mouth again. Okay, buccal mucosa is pink and moist. I have you lift your tongue. Tongue is pink and moist. Open your mouth more for me, please. Can you move your tongue up, down, left, right? Good. Sorry. Cranial nerve 12 is intact. Your hard palate and your soft palate are pink and moist as well. We're gonna pull down your tongue. I'm gonna look at your tonsils, okay? Pull down your tongue. Your tonsils are 2 plus. Cranial nerve 9 is intact. Okay. I'm gonna have you close your eyes. Okay, and tell me what you feel.
So.
Okay, cranial nerve 5 is intact. Okay. Can you please puff your cheeks? Smile. Clench your teeth. Very good. Raise your eyebrows. Okay, cranial nerve 7 is intact. Now going to the ears. We're going to inspect the ears. Ears are symmetrical. We're going to perform the whisper test. Have you cover that ear? Cover this ear. Tell me what you hear. Cover this ear.
1, 2, 3.
Thank you. Cover the other ear. Cover this ear.
Let me see.
Okay, cranial nerve 8 is intact. We're going to perform the Weber test. Do you hear the sound on both ears?
Yeah.
Okay, no sensory neural hearing loss when the Ryan test. Let me know when you stop.
Stop.
Let me know when you stop. Stop. Okay, air conduction is greater than bone conduction. Obviously, we do this on the other side of the ear as well. Okay, we're gonna palpate the mastoid, tragus, any tenderness. No tenderness. We're gonna insert a speculum in your ear. I'm gonna lift the pinna up and back.
Ooh, moderate mass rumen noted. No erythema, no discharge, no lesions. Tympanic membrane is pearly gray.
Okay. Okay. Cone of light was seen as well. And I will do the same thing to the other ear. Going down to the neck. Want to inspect the neck. No masses, no lesions noted on the neck. I'm gonna palpate your trachea. Any tenderness?
No.
Okay. And have you take a sip of water. Okay, all lobes are present. Any pain? No pain reported. No tenderness. Cranial nerve 10 is intact. Okay. I'm gonna palpate your lymph nodes now, alright? We're gonna start off with the preauricular, postauricular, occipital, submental, submandibular, posterior cervical chain, deep cervical chain, and subclavicular. Any tenderness as I as I palpate, no tenderness, okay? Moving on to the chest. Okay, we're gonna inspect the chest. Okay, no retractions, no difficulty breathing, no bulging, no redness. Okay, we're going to percuss. We're gonna palpate the chest. Any pain? We're gonna percuss for chest for the resonant sounds. Okay, resonant sounds were heard. We're gonna auscultate the chest. Breathe in, out, in, out, in, out, in, out. Okay. No adventitious breath sounds were heard. We're gonna go on to the posterior chest. We're gonna have you turn this way. We're gonna inspect your back. Okay. Okay, so we're inspecting the posterior chest. Again, no masses, no lesions noted on the chest. We're gonna percuss. Any pain?
No.
No pain reported. We're gonna palpate. That was palpation. Now we're gonna percuss. Okay, resonant sounds were heard. Now we are going to perform the diaphragmatic exertion. Have you breathe in. Hold. Okay. Breathe out. Now breathe in. Fully exhale. Okay. Hold. Okay. Distance between the two is 4 centimeters, which is normal. Okay. All right. Now we're gonna check for chest expansion. Have you breathe in, breathe out. Chest expansion is normal. We're gonna test for tactile fremitus. When you feel my hand, say 99.
99.
Awesome. Okay, 99 was muffled. I'm gonna perform the agophony test. When you feel my stethoscope, just say E.
E. E. E. E. E. E.
Okay, E was heard, not we're gonna perform now the whispered petroculi test. When you feel my stethoscope, I want you to whisper 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, very good. All right, AP to lateral diameter is 1 to 2, which again is normal. Okay, moving on to cardiac. I'm gonna check your blood pressure. Okay, blood pressure is 120 over 77. Pulse is 79. Okay. All right, we will check the pulse. Hold for 15 seconds. Okay, pulse is correct. That's 79. We're gonna identify the 4 landmarks. Second intercostal space, right side is the aortic. Second intercostal space, left side pulmonic. Fourth intercostal space, left side tricuspid. Midclavicular. Fifth intercostal space is the mitral valve. Okay. Now we're going to auscultate all 4 landmarks. Okay. We're going to auscultate now with the bell of the stethoscope. Okay, S1 and S2 were auscultated, and have you lean forward. I'm gonna auscultate your mitral valve again. Okay, very good. Okay. Now we're gonna have you lay down. The head of the bed is at 30 degrees. Okay. Alright, put your neck up for me. Okay, turn your neck to the right. For no jugular venous distension, we're gonna palpate your carotid. Carotid arteries 2 plus, turn to the other side. Palpate your carotid. 2 plus, very good. Now we're going to listen, auscultate your breath sounds again while the head of it is at 30 degrees. Start from center into second intercostal space. Okay, very good. We're gonna palpate your mitral valve. Okay, there's no no pulse deficit. We're gonna auscultate now the landmarks with the belt of the stethoscope. Okay, very good. Moving on to vascular. No cyanosis, no clubbing, no edema in the lower extremities. Patient looks healthy. We're going to palpate all your pulses, starting with the brachial, radial, femoral, dorsalis pedis, and posterior tibial. All pulses are 2 plus. Moving on to the abdomen. We're going to inspect the abdomen. Okay, we're going to auscultate for any bruits. We're going to abdominal aorta, or the belt of the stethoscope. The renal arteries. And femoral. Good. Now we're going to auscultate the abdomen, starting with the right upper quadrant, right lower quadrant, left lower quadrant, left upper quadrant. Okay, all quadrants are tympanic. We're going to percuss the liver. Okay. And liver is about 6 centimeters is normal. We're going to go down to the under the 5th intercostal space, palpate for the spleen. Okay, spleen was not palpable, which is normal. Any tenderness reported while I was palpating?
No.
No tenderness reported upon palpation of the liver and the spleen. Now we're going to gently press each quadrant. Any pain? Okay. Take a deep breath in for me and hold. I'm going to palpate the liver. Any pain? Okay, you can breathe normally now. Okay. So we palpated the liver, not palpate the spleen. Not palpable, which is normal. Okay. Okay, so that is that with the abdomen. We're gonna palpate the inguinal nodes. Any tenderness? No tenderness supported. We're gonna have you sit up. I'm gonna perform the costovertebral plunge test. Okay. Let me know if there's any pain, okay? Any pain? No pain reported. We're gonna have you stand up, perform the musculoskeletal exam, have you walk there and back for me, please. Thank you. We're gonna, good, you can turn around this way. We're gonna inspect the spine. Okay, no rashes, no ground in the spine, no scoliosis, no kyphosis, none of that. We're gonna palpate the spine. Any tenderness I palpated?
No.
Okay, now we're gonna assess your range of motion. Have you bend forward, bend back, bend to the side, to the side. Okay. Full range of motion on the spine. Okay. I'm gonna have you sit back down, please. Okay. I'm gonna palpate your temporomandibular joint, your TMJ. Any tenderness?
No.
Okay, no masses, no crepitus noted. Okay, can you move your jaw side to side like this? Okay, very good. No, everything's normal. I'm gonna palpate your shoulders. Let me know if there's any tenderness.
No.
No tenderness reported, no crepitus, no masses. Can you raise your arms above your head? Now swing them backwards. So like this, frontwards, and then backwards. Now take each arm, touch the opposite shoulder. Take this arm, touch the other shoulder. Okay, very good. Full range of motion in the shoulders. So we're gonna have you take your right arm and try to touch your left scapula. Take the other arm, touch the opposite scapula. Then we'll have you shrug your shoulders like this. Cranial nerve 11 is intact. Then we're gonna palpate your elbows. We'll palpate any tenderness, no tenderness, no crepitus, no masses noted. Can you make a fist for me? Go like this. Extension. Okay, extend. Now flex. Okay, full range of motion in the elbows. Okay, you're gonna palpate the wrists. No tenderness, no crepitus. Can you flex, extend, make circles with your wrist this way, that way? Okay, full range of motion in the wrist. We're gonna palpate your fingers. Fingers up, down, move each finger, take each finger to touch your thumb. Very good. Full range of motion in the fingers as well. Can you make a fist? Open, fist, open, full range of motion in the hands. Going down to the legs, I'm gonna have you extend, flex, other leg, extend, flex. I'm gonna palpate the hips. Any pain?
No.
Any pain?
No.
Okay, lay down please. Pick up your knee. Lay down, pick up your knee to your chest. Okay, pick up the other knee to your chest. Okay. Alright, we're gonna do external rotation and an internal rotation, adduction, abduction. Okay, now we will do the same thing for the other leg. Move on to the knees. So have you bend your knees? Okay. Bend your knees. Okay, great. Full range of motion on knees. We're gonna palpate the knees. Any tenderness? Okay, we're gonna go down to the ankles. We're gonna palpate the ankles. Any tenderness?
No.
No masses. Can you make a circle with your ankles? Okay. Okay, now the opposite direction. Very good. Full range of motion in the ankles as well. Okay, I'm gonna palpate your foot. Any tenderness?
No.
No tenderness. Any tenderness?
No.
Okay. Lower your right. Pull up. Okay, very good. Full range of motion in the lower extremities and the legs as well. Okay. Alright, now we're gonna test your muscle strength. I'm gonna have you sit up. I'm gonna test your TMJ. Okay, can you clench your fist and try to resist me opening your mouth? Okay, strength, TMJ strength is 5 out of 5. 5 out of 5. I'm gonna test your neck strength. Try to turn your neck. Other way, try to turn your neck. Okay, good. Good neck strength, 5 out of 5. Try to raise your shoulders. Oh, great. So shoulder strength is 5 out of 5. I'm gonna test your your elbow strength. Try to push down against me. Good. This elbow, try to push down. Okay, elbow strength is 5 out of 5 as well. Great. Test your hand strength, your wrist. Try to pull down against me. Good. Now the other way. Try to pull up. Wrist strength is 5 out of 5. Okay, we're gonna go down to your knees. Have you extend your leg. Try to push up against resistance. Great. Try to push down. Awesome. Opposite leg. Push up. Push down. Okay. Going up to the fingers. Only just trust your finger strength. Go up. Great. Down. Awesome. Finger strength 5 out of 5. Leg strength 5 out of 5. Now we're gonna test your foot. Okay. Have you pull down? Great. Pull up. Okay. This foot. Pull. Push up. Great. Push down. Foot strength. 5. 5 out of 5. Okay. Full body muscle strength 5 out of 5. Okay. Now I'm gonna close your eyes. Tell me what you feel. Okay. We'll test for sensory.
Pinch.
Pain. Pain.
Pain. Pain.
Okay.
Dull. 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 Smooth. 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 Smooth.
Tell me what you feel.
Pain. 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 Pain.
Okay. Have you closed your eyes? Tell me what's in your hands. What is this? Alright, very good. Okay. Alright. So that's good. We're going to have you stand up. From the Romberg test, have you close your eyes. Try to hold. Okay, there's no swing. Very good. I want to have you walk from heel to toe. Have you walk backwards on your heels. Okay, awesome. Very good. Okay, we're going to have you lay down. We're going to perform the tendon reflexes. Give me your arm. Okay. Do the same thing for the other arm, under the knee. Great. Okay. Achilles tendon, we're gonna go under. Great. All reflexes are 2 plus. We're going to perform the Babinski test. I'm going to have you lay down. Draw a J shape on your foot. And see if your toes clench downward. Okay, very good. Very good. Okay, we are done with today's assessment. Thank you for your time.